And in Obamacare, unfortunately, we see a lack of accountability when a government gets too big and tries to do too much. We see incompetence, we see broken promises, we see arrogance, we see massive cost, we see failure. And it's not because we want it to fail. We want it to work, but it's not, and it's disappointing because health care does need fixing. It does need fixing, but this is not working. By growing government in Washington and by putting government in charge of health care, we haven't fixed it. We've made it worse, and we've deprived the American people of the ability to control their own health care. Obamacare's problems are much bigger than a billion-dollar website that doesn't work. The problems are coming at the American people in waves. The website's just the first wave. Last Sunday's report that the administration had made some 400 software fixes doesn't mean that the federal website is working. The back-end website is still unfinished, and insurers are unable to obtain the accurate information about the people who have enrolled. There's also the real problem of the security of the website. McAfee says the site is a hacker's dream. Personal, sensitive healthcare and financial information at risk. No wonder, according to a recent Pew survey, only 19% of Americans trust the government to do what is right always or most of the time. Then there's the broken promises. If you like your doctor, you will be able to keep your doctor, period. If you like your health plan, you'll be able to keep your health plan, period. No one will take it away no matter what. Well, tell that to the 16 million Americans who are losing their current health insurance and slowly discovering that their doctor, with whom they may have had a relationship for years, or who may be treating them for a chronic disease, is no longer in their network. Obamacare was supposed to decrease the number of the uninsured, but at least at the outset, far more Americans have lost their health insurance rather than gained it. You may like the policy. You may like Obamacare. You may not like Obamacare, but at least one thing is certain, and that's that the American people were not told the truth about whether or not you can keep your health insurance. And think about the arrogance of government officials who dismiss these concerns by outlawing insurance policies freely chosen and voluntarily purchased by consumers and freely offered and affordably priced by insurers. Some say these policies are substandard. These insurance products may not meet the one-size-fits-all criteria of a government bureaucrat. But why should the government decide that? Why not let individuals and families decide what products they want, what health care they can afford, instead of having Washington dictate those choices for them? And finally, the cost. Premiums are skyrocketing. When people are able to sign up on the exchanges, or as they're getting their premium, like Tony, they're discovering insurance is no longer affordable. And it's not affordable for the taxpayers either. The President said in the weeks before and during the shutdown that Obamacare shouldn't be part of the discussion about funding the government or raising the debt limit. But Obamacare, the Affordable Care Act, is fundamentally connected to spending and debt. It was passed, after all, through the budget reconciliation process, which is a budget-related law. And so if we are just to now totally disregard a $2 trillion spending bill in the context of how are we going to manage our finances in the next decade, in the next 2 decades, the next 3 decades, that's inconsistent with Congress's ongoing responsibility to constantly scrutinize federal spending. And all of this is so unfortunate because we have offered and we will continue to offer real reforms. We know that Obamacare doesn't work, but we haven't tried simple patient-centered reforms that would lower the cost without growing government.